Good day, I am student nurse Christine Jones Alce, and today I am going to demonstrate ear irrigation. So ear irrigation is the gentle washing of the ear with a stream of solution for presence of foreign body, inflammation, and accumulation of cerumen. So the purposes of this procedure are to remove foreign body from the ear canal, to reduce inflammation of the ear, and to remove accumulated cerumen. The materials needed for this procedure are clean gloves, irrigation syringe, basin, emesis basin or other receptacle to collect drainage or irrigating solution. We also have examination light or the drop light, towel, cotton balls, prescribed irrigation solution like mineral oil or over-the-counter softener, and we can also use otoscope for this procedure. So we will now proceed to the assessment. First is we have to review physician's order, including the solution to be instilled and the affected ear to receive irrigation. So this is for legality purposes of the procedure. Next is we will review the medication record for history of ruptured tympanic membrane, and in this procedure we can use an otoscope. This will serve as a baseline data and also to know the present condition of the patient. And then we will inspect the pinna and the external auditory meatus for any redness, swelling, drainage, and abrasions, and if there is presence of cerumen or foreign objects. So always attempt to remove foreign objects in the ear by first simply straightening the ear canal. And if vegetable matter is occluded, like if there is beans or pea in the ear canal, we do not perform the irrigation. So obstruction of the ears can be removed if there is minimal damage only. The next thing that we're going to do is to ask the patient if he or she is experiencing discomfort, and we will note the patient's ability to hear clearly, because inability to hear clearly may indicate obstruction in the ear canal. And then we will review the patient's knowledge of purpose for irrigation and of the normal care of ears. So this is to ensure proper treatment is given to the patient. For the planning, the first thing that we're going to do is to prepare the irrigation set and other materials needed for the procedure, and this is to save time and effort. And then we will identify the patient to ensure that the procedure will be done to the right patient. And then we will explain the procedure and warn that the irrigation may cause sensation of dizziness, ear fullness, and warmth. So this is to prepare the patient and to lessen the anxiety and also to gain cooperation. And then after that, we will plan the need for assistance to ensure that patient is safe. Good morning, ma'am. I am student nurse Christine Jones Alce. May I know your name, please? Okay. So today, ma'am, I am going to perform ear irrigation, and this procedure will help you to lessen your discomfort and also to clean your ears and to remove the cerumen. And this procedure may cause dizziness, and you will feel sensation of like warmth in your ear after the procedure. So I am going to wash my hands and we will proceed to the irrigation. We will now proceed to the implementation. So the first thing that we're going to do is to perform hand hygiene for infection control and also to prevent cross-contamination. So after that, we will arrange the supplies at the bedside, and we will don clean gloves for easy access of the materials and also to prevent any delay of the procedure. And we all know that donning gloves serves as a barrier for the disease control and infection control. So I already washed my hands and I will don clean gloves. After that, we will position the examination light to illuminate the affected area. So this is to have a clear visualization of the patient's affected ear. Next, we will assist the patient to lie in position with head turned towards the affected area. This is to allow gravity and to let solution flow naturally. And then we will place towel under the patient's head and shoulder, and we will have the patient hold the emesis basin under the affected ear. This is to prevent soiling of the bed and as well as the patient's clothing. So, ma'am, position lang tika, ma'am, ha? Nanatagil gamay, ma'am. Then, ma'am, i-hold lang ni ma'am, ha? Next is we will pour the irrigation solution into basin. This is to measure the irrigation solution accurately. And then we will gently clean the auricle and the outer ear canal. And we will moisten the cotton ball applicator. This is to provide better visualization of the ear by removing the dirt or cerumen present in the ear. And then we will moisten the cotton ball. Cleanse the auricle. Ma'am, maglinis ako, ma'am, ha? The outer ear canal. So now, we will fill the syringe with warm solution in 38 degrees Celsius in approximately 50 ml. So this is to avoid refilling and to save time and effort. So this is the irrigation solution, and we will fill it up to 50 ml. Okay. So this is 50 ml. So we will now start to clean the ear of our patient. So for adult and children over 3 years old, we are going to gently pull the upper portion of the pinna up and back. And in the age of 3 years and below, we will pull the pinna down and back. So since our patient is adult, so we will pull the upper portion of the pinna up and then back. So this is to straighten the ear canal and to have a clear access. So we will slowly instill the solution by holding the tip of the syringe 1 centimeter or a ½ inch above the opening of the ear canal. This is to avoid irritating the tympanic membrane. And we will direct the fluid towards the superior aspect of the ear canal, and we will push the bulb, or we will depress the bulb in a slowly and careful manner. So this is to begin the irrigation and to irrigate foreign substances present in the ear canal. Ma'am, maglinis na ako ng ears mo, ma'am, ha? So we are going to pull the pinna up and back. So I will allow the fluid to drain into the basin during the installation. I will continue until the canal is cleansed or until the desired amount of solution ordered has been used. Clear drains mean that the ear canal is already clean. Now, I will inspect the ear canal to see if it is clean, and I will dry the ear and neck area. So, drying the ear and the neck area will prevent harbor of microorganisms, because moisture can harbor microorganisms. After cleaning the ear and the neck area, or after drying it, I will put a cotton ball and leave the cotton ball loosely in place for 5 to 10 minutes. Application of the cotton balls prevent moisture in the ear canal. So, ma'am, maglagay ako ng cotton sa ears mo, ma'am, ha? After that, I will assist the patient to a comfortable position to make sure that the patient is comfortable after the procedure, and then I will dispose the supplies and remove the gloves. So, this is to avoid spread of microorganisms. Excuse ma'am, tanggalin ko lang po muna. Disposing the supplies and removing my gloves, I will perform hand hygiene to prevent cross-contamination and to deter the spread of microorganisms. So, for the evaluation, we will ask the patient if discomfort is noted during the installation of solution. This may be because of the improper irrigation, and we will ask patient about sensation of dizziness and lightheadedness, and also we will re-inspect condition of the meatus and the ear canal to ensure that the procedure is correctly done, and we will let the patient describe the purpose of irrigation and poor technique for ear care, and also we will ask the patient about the improved hearing. This is to ensure that the procedure is correctly done. For the documentation, I have recorded in the nurse's notes the procedure, amount of solution instilled, the time of administration, and also the ear receiving irrigation. And also, I have noted the appearance of external ear and patient's hearing acuity in the nurse's notes. And I also report adverse effects, or if patient's response or withheld drugs to nurse in charge or physician. So that is all for the return demonstration of ear irrigation.